All right, so let's talk about when things go wrong. We're going to talk about CAD or CAD. We're going to talk about like congestive heart failure. We're going to talk about arrhythmias, and then normal versus abnormal heart sounds. So CAD, or coronary artery disease, this is when we don't have enough blood flow, not enough blood supply to the myocardium, and so the heart is not being properly serviced in terms of oxygen and waste removal and all that. This can include problems like chest pain. The person can be short of breath. They can have tachycardia or an increased heart rate and lightheadedness. There are different things that can cause this: atherosclerosis, coronary artery spasms, clots, right? Again, that atherosclerosis is where we have that plaque buildup inside the walls of the arteries. And usually when we think of coronary artery disease, we're looking at certain risk factors like high blood pressure, high blood cholesterol, smoking, obesity, diabetes, stress, right? People who experience a lot of stress, and sedentary lifestyles are all things that can kind of contribute to this. And then congestive heart failure, this is where the heart as a pump is not very efficient. It's not effective. So for whatever reason, the heart is not filling or pumping properly. So like on the systolic side, we see that the chambers are thin and stretched out, so they cannot squeeze very well. Or on the diastolic side, we have chambers that are very thick and stiff, and so we can't fully fill them, right? Both of them are going to have some similar symptoms, whether it's the thick chambers that don't fill very well or thin chambers that don't pump very well. We're seeing problems like shortness of breath, fatigue, swollen legs, and a rapid heartbeat. A lot of the things that can cause this are coronary artery disease that's gone untreated, high blood pressure, and damage to the heart muscle. The treatments include lifestyle changes like limiting fluid intake and eating less salt, as well as taking certain prescription medications or even inserting something like a pacemaker. And then we have arrhythmias. Arrhythmias are just abnormal rhythms. So we saw before that nice P wave and then the QRS complex and then the T wave afterwards, and it was nice and pretty. Arrhythmias are going to be different. They're not going to have that nice pattern. And so one can be like bradycardia, where the heart rate's just low. It still has the pattern, but it's low. Tachycardia, where we have the same pattern, but it's happening too fast, right? Heart rate's too high. And then we get into the ones where things are like not following that nice pattern, like atrial fibrillation, where atrial contraction is not synchronous. And so we don't see really good cardiac output because the atria are not, they're not contracting well in the right pattern, and so they're not filling those ventricles correctly. Ventricular tachycardia or VTAC, this is where we have too fast of contractions and they're out of sync. So we see this kind of just up and down, up and down, up and down, right? Where the ventricles are kind of going crazy. It's almost like that QRS complex happening over and over again. And then ventricular fibrillation, right? This is where we're not synchronous with the ventricles, right? So we see that we're just kind of all over the place. It's not nice and neat at all, right? So in the atrial fibrillation, you see your like P wave does not look normal. You see that QRS complex still, but you don't see that P wave nice and neat. Ventricular fibrillation, you see that QRS complex has just disappeared, right? That we saw before. And then ventricular tachycardia, it's like the QRS complex that is just happening over and over and over again. You don't really see much else. Ventricular fibrillation, this is the worst of these. It's the most deadly. This is where you're going to have to do something like CPR, or you're going to need to do like the paddles, right? Where you have to, use like a shock, right? An electrical impulse to try to basically reset the rhythm again. There's also heart block. This is basically the conduction path has damage or the AV node has damage, so we still get the impulse in the ventricles, so we still see like that QRS complex, right? But it's slower. We don't see that happening the way that it should. If it's first degree. If it's second degree, right, not every impulse gets there. And so we see, like, look how far apart those are. So like here, we're looking at a span of about 6 seconds, right? And so we're seeing like, oh, there they are, right? Here, it's happening way less frequently. And those intervals get longer unless we fix it. And then to a complete one, a third degree, no stimulation gets through, right? The Purkinje fibers can kind of continue this on their own, but we see it is happening very infrequently, like every couple seconds, which is a long time. So this is going to be the most serious of them. We see how we went from QRS complexes happening every so, like, very often to becoming less and less frequent as you go from first to second to third degree block. When we look at the sounds of the heart, we can hear the heartbeat through what's called auscultation. Auscultation is just listening to things. And so we can hear basically how the blood flow changes when heart valves close. So you think about, like, you close something, there's actually going to be turbulence. The blood will flow. It's called laminar flow. It'll just flow forward. And when those valves close, it kind of disrupts that forward flow a little bit. It kind of almost circles around. Kind of like if you were to splash water, right? It's going to cause like a splash right in there. So we get turbulent flow, and we hear that turbulent flow with the when we hear the heartbeat. So the first sound is the lub. That's when we have the AV valves close, right? This is going to be right after that QRS complex. The heart sound we hear next is the dub. That's when the semilunar valves close, right? So if we're listening, right, QRS complex right here, we hear that for the AV valves close here as the ventricles are about to contract. And then the semilunar valves close after that contraction is over and blood is flowing, from the ventricles into the, like the aorta, and the semilunar valves close behind it. Now, murmurs are going to be abnormal sounds. This is because the valves are maybe faulty, and so we're hearing noises that we shouldn't necessarily hear. And we can hear them in different places depending on which valve is affected. So if we're looking at their color coding, right, we can hear them in the semilunar valves, like the aortic semilunar valve listening here. We can hear the pulmonary semilunar valve by listening here. The tricuspid are between the atria, the right atrioventricular valve right here, and then the mitral or the bicuspid valve, right, which is going to be on the left side right here. So that's kind of where we would listen for those guys. Most of them are going to be more left, with the aortic valve being the one listened to on the most right side. And so when can we hear these weird sounds, right? We call it a heart murmur when we hear an abnormal heart sound. And again, this is because the valves are not closing properly or opening properly. So for example, like aortic stenosis, this is where the aortic valve has hardened. This can cause congestive heart failure. Mitral stenosis, the mitral valve is stiffening and not moving properly, basically. This can lead to pulmonary hypertension. And then things like regurgitation, or the valves are not closing properly. So let's say like mitral valve prolapse, where the mitral valve is actually kind of flowing backwards or moving backwards and opening when it shouldn't be. There's also septal defects, where we have holes in the septum that divides the left and the right ventricles. Usually this is because the foramen ovale has not closed properly right between birth. So we would see, if we're looking up here, here's our normal one, or here's our first sound or second sound, right? And then beginning on the next heartbeat. On the aortic stenosis, we just hear a sound all the way across the board, and it's like loud and then quiet. Mitral regurgitation, it's like constant as the ventricles contract. Aortic regurgitation, we hear it when we shouldn't hear anything. The mitral stenosis, we hear quieter sounds when we're supposed to, and then we hear a noise in between when we shouldn't, leading up into that first sound. And then with patent ductus arteriosus, it's just constant noise. It's just never quiet, right? There's always some sound that we're catching.